and what brings you in today?
Hi. Yesterday at softball practice, we did long toss for the first time in a while, and I started to get pain during it. It wasn't like sharp, excruciating pain. It was just dull, achy pain, kind of like on the front side of my shoulder. And after practice, I iced it, and there was really nothing I was too concerned about. But then today, it's still painful and more than normal. So I took ibuprofen, and it helped, but didn't really take it away.
Okay. Yeah, well, we'll take a look at that and see if we can figure out what's going on. I'm sorry to hear your shoulders hurting, though. So it's January now. So we just came back from break. Did you do a lot of throwing over break, or was this kind of a big increase in volume?
I did a little bit, but it wasn't long toss.
Okay, that makes sense. So it was a little bit more intense than we've been doing in a while. Have you ever hurt this shoulder before?
No.
Okay. No surgeries, no dislocations, anything?
No.
Can you point to where it hurts again?
Like right here.
Okay. And when you did it, do you remember anything specific, like when it happened? You were doing long toss. Do you remember one particular throw? Any sounds, popping, clicking?
No.
Okay. Nothing like that. It just kind of over the course of all the throws started hurting?
Yeah.
Okay. And do you remember where in your throw it bothers you? Is it like when you're starting, ending, following through? I mean,
probably the follow through, kind of middle throw.
Okay. Yeah.
Area.
Okay.
Yeah.
Thanks. And you are right hand dominant. You throw with your right hand, right? Okay.
Yes.
Just checking. And you said that you iced it after practice and you took some ibuprofen. Have you done anything else to make it feel better?
No, that's it.
Is there anything you've noticed that makes it feel worse as you've been going out throughout the day today?
Like lifting my arm kind of hurts, and like this movement hurts a little bit, but other than that, no.
Okay. Yeah, and then you talked about how it felt, the type of pain that it felt dull. If you were to give that a grade, the severity of pain, a grade 0 to 10, 10 being the worst pain ever, how would you give it a grade?
3.
Okay. And you already said you haven't had anything happen before. Is it all right if I touch your shoulder?
Yeah.
Okay. I'm gonna take a look, and I don't see any differences from side to side or any swelling or anything, redness. I'm gonna start in the back, which is where it probably doesn't hurt.
Yeah.
Any tenderness up here?
No.
Anything on the back here?
No.
Okay. And then here on the side, anything out here?
No.
Okay. And then I'm just gonna follow this bone around. Anything right here?
No, not really.
Okay. And then over here on this bone?
No.
Nothing there? No? Okay, so now I'm gonna get where it probably is a little bit more tender and palpate several different structures here. How about in here?
Yeah, that hurts.
Okay, right in there. I'm just gonna confirm, I'm looking for a specific spot, confirm I'm in the right spot there. Yeah, right there?
Yeah.
Is that where it hurts? Okay. I don't feel any crepitus, but I can definitely see that's tender. And then right farther to there?
Yes,
A little bit?
Little
Okay.
bit.
And then down here?
No.
And then on the like belly of your biceps here, anything there?
No.
Okay. All right, and just for comparison, I'm gonna poke around on the other side a little bit and tell me if you have any soreness up here,
No.
down there, and then again on these bones here,
No.
and in here.
No.
Nope. Okay. And I'm gonna have you do some movements for me.
Okay.
The first one I'll have you do is I want you to raise both arms overhead all the way up. Perfect. And then you can bring it back down and then do the same thing except out to your sides. Good. Equal motion that way. And then with your arms here at your sides, I'm going to have you rotate out as far as you can. Good. And then back all the way in. Yeah, your belly goes in the way. It's fine. And then we'll have you do that same thing except with your arms like this and then out. And then all the way in. That one was a little bit easier to do.
Yeah.
Okay. And then one arm at a time, you're gonna come across your body. Okay. And then across. Great. All right. And I'm gonna have you actually stand down on the ground for a second for me and then face that way. And I'm just gonna pull your hair up in front a little bit. And then I want you to Raise your arms all the way out to the side, both of them all the way above your head. And I'm just gonna watch how your shoulder blades move. Yes, perfect. So just 3 or 4 times like that, and watching that shoulder blade just to see if it moves symmetrically with the other side, to see if that contributed to your shoulder pain at all. Great, perfect. And you can turn around and sit down if that's more comfortable. We're gonna, your range of motion looks good, equal on both sides. The next thing we're gonna do is test your strength.
Okay.
So I'm gonna start here on your uninjured shoulder, and we're gonna start by having with your elbow straight. You're gonna come all the way up, and I'm gonna resist against you. So I want you to pull up against me. So pull, 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 all the way up, all the way up, all the way up, all the way up. Great, good work. And then we'll do that same thing on this side. So pull all the way up, all the way up, all the way up, all the way up. Great. And that was a little bit weaker on that side.
Yeah.
Was that painful?
Yeah, it hurt.
Okay, where does it hurt?
Like right here.
Right up at the top.
Yeah.
Okay. We're going to test your elbow strength as well.
Okay.
And so again, you're going to just curl up like that. So curl against me. Great. And then same thing, curl against me. Okay. So the full strength on both sides there. Any difference in sensation?
This one hurt a little bit, but not.
Still up at the top?
Yeah.
Okay. All right. And then this next one, I'm going to have you relax. And I know it hurt to lift your own arm, but if I lift it for you, does that bother you?
No.
Nope. What if I go like this? Does that bother you at all?
No.
Okay. Good. And I'll do that same thing here. Just let me lift it. Is that okay?
Yeah.
And then here, does that bother you?
No.
Okay. And then next thing we're gonna do is actually compare your extension. So again, I'm gonna have you relax. I'm just gonna bring your arm back like that. Is that all right?
Yeah.
Okay. And then this one, tell me if that stretches that front side of your shoulder. Does that, as you're relaxed, does that, can you feel it there on the front?
A little bit, yeah.
Okay. All right, and then next we're gonna check some other muscles. So those are some of the main muscles I think are involved, but we're just gonna screen through several other ones just to make sure we know what's going on.
Okay.
So this first one, I'm just gonna have your arm out like this. We'll start down, and I'm gonna have you rotate up, and I'm gonna resist you.
Okay.
So push, 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 push. Great. And then pull back down. Pull, 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 pull. Great. And we're gonna do that same thing with you right here. I want you to push out, push, 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 push. Okay. And pull in, pull, 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 pull. Great. Okay. We'll compare it on this side. So we'll start in, push up and out. Great. Good. And pull back in. Good. And then here, and I want you to push out. There we go. And then pull back in. Good. All of those were great strength. That's perfect. And while we're here, I'm gonna have you put your hands on your belly, elbows up high. Don't let me pull your hands off your belly. Perfect. Great strength there. We almost took the table out. It happens, you know, totally normal.
Yeah.
Great, that looks good. You can relax
Okay.
there. I'm gonna go like this a couple times. Is that uncomfortable at all?
Yeah.
A little bit uncomfortable where?
Right around here.
Right around there?
Yeah.
Okay. Same thing here. That bother you?
No.
Okay. And let's see, we're gonna do another one for some of those external rotator muscles. So I'm gonna have you have your arms out like this and hold those there. Don't let me push you down. Okay. Great, nice and strong. And I'm gonna have you actually do another one like that. I want you to start with your hands all the way up and then just slowly lower down. Perfect. Those all look good. Actually, I think we're gonna do a couple things where you're laying down. Let's have you lay with your head this way. All right, so this first one, what I'm gonna have you do is I'm gonna have you pull your arm across like that, and I'm gonna resist you.
Okay.
So pull across, pull, 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 pull. Okay. That sore at all?
Yeah.
Okay, a little bit. And then let's, it's a little bit sore. We're gonna do the same thing on this side so I can compare
Okay.
strength. All right, pull across, Pull, 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 pull. Good. All right, so there's a little bit of weakness. It was pretty strong on that side, but
Okay.
a little bit there. And then while I'm over here on this side, I'm just gonna look at how much your joint moves just naturally. So I'm just gonna kind of poke at this bone here and wiggle it around. It's called joint play assessment. I don't think there's anything moving around in here, but we'll test it on both sides just to get the comparison. In here, so just try and relax. And I'm just gonna, I know it feels a little weird. I just poke at your humerus there. That's your shoulder bone. And then pull there. Okay, looks good there. All right, we're gonna do one more strength test. Your arm is gonna be up like this, and then I'm gonna have you pull back down towards your own side. So you're gonna just pull straight down against me, pull, 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 pull. Great, and you can relax that side. We're gonna do the same thing over here. And pull, 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 pull. Great. All right, and then you can sit up again and actually stand here beside the table. Okay, and I'm gonna have you actually standing just as you are. You're gonna put your hand over your low back, just one hand at a time actually. And I want you to lift this hand off your low back and hold it there. Don't let me push it down. Good. And then other side. And yep, hold it off. Don't let me push it down. Good. And relax. And then you can face this direction. And I'm going to have you raise your arm like this. And then I'm going to have you with your palm up. Hold that there. Don't let me push it down. Good. And then I'm going to have you go like that. And hold that there. Don't let me push it down. Any discomfort on that side?
No.
Okay, and then relax, and we're going to do the same thing over here. We'll start palm up. Don't let me push it down. I'm cringing a little bit.
Yeah, that one was
okay.
Painful.
And then better or worse?
Better. Wasn't as painful.
Okay, so out here, where is it that you feel it out here?
Like right here.
Right in the front, so not deep inside?
No.
Okay. I'm going to have you almost make an uppercut. So you're going to flex your elbow and then flex your shoulder and go straight up.
Okay.
And I'm going to resist you on that one.
Okay. Yeah, that one hurt.
Is that the worst so far?
Yeah.
Okay. And I'm going to have you do this one. This one, you're going to have your hand here, and you're going to start like this, and then you're going to rotate out. So it's both rotating out and you're kind of flexing your elbow a little bit.
Okay.
And I'm going to palpate up here while you do so. And that one was okay?
Yeah.
Okay. All right, we're gonna do those same two on this side. So again, you're gonna do that uppercut motion, and let me know. How's that feel?
Fine.
Fine?
Yeah.
Okay, and then here you're gonna start in, and you'll come out. So, yeah, it's a weird motion. That's totally fine. Okay, and that feels okay?
Yeah.
Okay, good. And then we're gonna do one more strength test that I missed the first time.
Okay.
So I'm gonna have you go out like this and all the way above your head.
Okay.
There we go. And relax. And the same thing. Out, all the way to the side, all the way above your head. Okay. Great strength on that one too.
Okay.
All right. And you can have a seat. Out of your way. Thank you. Okay, so let's talk about what I think is going on. So this area right here that you're sore is right over your biceps tendon. So this one's cut right here, but you can see this is what your right shoulder looks like, and this would be your biceps muscle right underneath it.
Okay.
So this tendon runs through a little groove there and goes in and inserts into your above your shoulder blade on the inside there. This tendon doesn't run through this groove, which is this one right here. Can get really inflamed and sore, especially when we do overhead throwing activities. And so what we need to do is decrease the inflammation. We can do that with different treatments, different medications, with rest, so that this tendon isn't so inflamed anymore and causing your symptoms. Your bicep at your elbow joint, you're probably familiar with that, it helps do it like a biceps curl. But at your shoulder, it also does things. It also a muscle that goes like this and flexes. It's also one of the main muscles that decelerates your shoulder after you throw. So that's why you might notice it at the end of a throw, because your biceps works really hard to slow your shoulder down at that point. So those are some of its main roles at the shoulder joint as opposed to the elbow, which is what most people think about when they think of the biceps.
Yeah.
So that's what's, I think, going on, is that we have some inflammation of your biceps tendon or biceps tendonitis. And so we're going to plan our treatment plan to try and address some of those causes.
Okay.